When you or a loved one needs care at home, you're already worn out, and there's so many things to remember and to take care of. But there is help available that includes your health and more. Lavelle Dabney is here to explain. Lavelle is a home care liaison with Omni Park Home Care, one of the largest minority-owned home health care agencies in the Cleveland area. So welcome to the show.
Oh, thank you, thank you.
So I think your title kind of gives a hint at what you do, but tell us, what is a home care liaison?
Well, I'm like the middleman. I'm the person who's the intermediary between the physician and the home health care patient. So my job is to make the transition smooth for the patient, you know, make it a smooth transition from wherever they're being discharged from, whether it be an assisted living home, whether it be it could be a nursing home, the hospital often, and making that transition smooth for them.
Okay, so how do you do that?
Well, actually, I work to help patients understand their Medicare better. Actually, Medicare covers home health care 100%, straight Medicare does. And a lot of patients don't know that. So I find myself enlightening a lot of seniors, you know, to this information, because a lot of them have this benefit and they don't even know that, you know, that it's there.
Yeah, unless you're really paying attention, they probably wouldn't. So,
right.
And it can be people who need some really skilled kind of help at home, right?
Exactly. Well, it's classified as being homebound. You have to be homebound to actually get this benefit. So that's someone is very taxing for them to get around. A lot of them are walkers or wheelchairs, or they need assistance typically getting around.
So it'd be hard to get out to the doctor so they can get the help at home. So
exactly.
If they qualify and are eligible like that, what happens next in the process?
Okay, well, after seeing if they're eligible, we have a form I fill out. All I pretty much need is the name, the address, date of birth, and their Medicare number. I can see if they're eligible. Okay. Upon seeing if they're eligible, what we have is a nurse comes out and does an assessment on the patient. Okay. And once they do an assessment, they gather, you know, the needs of the patient. And we can cover things as far as skilled nursing and all the different therapies such as physical therapy, occupational therapy, and as well as speech therapy. Okay. So they get assessed for all those things.
How often can they see somebody?
Well, generally, when we're dealing with skilled nursing, you're looking at 1 to 3 visits a week, up to hour visits that'll be covered pretty much 100% through Medicare, nothing out of pocket for the patient. Okay,
so you're getting this arranged and this is all happening now, but you're not out of the picture at that point, correct?
Oh, no, not at all, not at all. I'm the point of contact, so more or less this patient becomes my account. You know, if you look at it from a salesperson's perspective, you know, this patient is my account. So I'm there for them if they have any questions, any issues, you know, I'm the point of contact.
So what's Care Aware?
Care Aware, it's a trademarked program that we have at Omni Park Home Health Care that's unique in the industry in the way that it improves the communication process. So now you have a point of contact that we give the doctor. You have the number of the nurse, you have the number for me, you have the number for each person that is involved in this home care case. So that's really what's missing out there in the industry is the communication, you know, proper communication. A lot of times the doctor doesn't know what's going on with the patient until they see them next, and this solves that.
All right.
This addresses that.
I think it's a really critical piece. I see a lot of seniors in my law practice, and man, they get used to tell. Quality home care includes care in the home and beyond. A home care liaison can handle a variety of issues that arise. To find out more, use the information that's coming up next. My thanks to Lavelle for joining us today.
Oh, thank you.
Learn more by calling the Omni Home Healthcare at 216-289-8963 or click to www.omniparkhealthcare.com.